Okay, so good afternoon, everyone. So I'm Dr. Chong, psychiatrist and lecturer at UPM. A warm welcome to all of you for spending the next 1 hour with us in this first webinar of a series of mental health related public talks organized by the Department of Psychiatry UPM in collaboration with Pfizer. These are some of the annual activities we organize in conjunction with the World Mental Health Day, which falls on the 10th of October every year. And yeah, that's about 2 weeks from now. So this webinar will consist of a presentation of 45 minutes and followed by audience discussion for 15 minutes. The following webinar will be recorded and made available for free distribution upon request. Viewers can ask any questions via the Q&A tab or chat tab available at the Zoom apps. Viewers can request to unmute themselves during the audience discussion session if they want to. So this year, our world is experiencing the unprecedented impact of the current global health emergency due to COVID-19 that has also impacted on the mental health of millions of people. We know that the levels of anxiety, fear, isolation, social distancing, uncertainty, and emotional distress have become widespread as the world struggles to bring the virus under control and to find solutions. This bleak picture necessitates that we ensure that mental health is prioritized now more than ever before. Mental health coverage should be an integral part of the universal health. Nobody should be denied access to mental health care. Thus, that's the theme for our Mental Health Day this year. Mental health for all, greater investment, greater access, everyone, everywhere. As mental health is crucial for every human being, the mind is where we have to take good care of. Yet a person's mind is so powerful but fragile at the same time. Without further ado, I would like to introduce our speaker today, Dr. Eugene Kong, to speak to us on a very interesting topics that close to his heart. Mental health, the world needs all kinds of minds. Dr. Eugene is a colleague and good friend of mine who works as a psychiatrist and lecturer at UPM. He has an extensive CV, so I have to summarize here by just describing to you what I know about him. An acceptance and commitment or ACT therapist and trainer, a researcher who wins many travel awards, a frequent speaker for international and national conferences, as well as a finisher in Ironman Malaysia who has keen interest in sports psychiatry. So with that introduction, let us welcome Dr. Eugene to deliver his topic today.
All right, thank you very much for the very kind introduction, Dr. Chong. Chong and I go way back, and I think he wasn't exaggerating with the introduction, but there are things that I'm actually very shy to tell people about it. But anyway, back to this. So today I'm actually going to talk a talk that's called "The World Needs All Kinds of Minds." But this talk is not going to be an academic talk. Instead, I'm going to cater this to everyone so that everyone could relate to it. And especially as Chong mentioned just now, relate in these troubled times. Because often in these times, a lot of people find themselves asking themselves, am I unwell? Am I having a mental illness? Am I sick? And am I distressed? Should I go actually see a doctor, etc.? These kind of questions tends to pop up because, you know, we all of us were confined for a long period of time. We have a lockdown, and then even now without lockdown, we still have a lot of restrictions. And some of us will actually experience a lot of changes in their day-to-day life. And because of that, these questions keep popping up. So I would like to just paint a slightly different picture why this question pops up. Instead of addressing it from a psychiatry point of view, instead of saying this is an illness, this might not be an illness, I'm going to just be a bit different by giving you all a different perspective. So I'm going to begin with a story. So what I usually like to do is I like to use stories because I find that people relate with story much better. I'm going to tell you a story about Abeng, Aming, Ajing, and Aling. These are 4 people during the caveman periods a long time ago. All right. Abeng, he is the so-called chief of the tribes, fearless. He always takes risks. He always goes out without fear. He dares to chase after the biggest animal without fear of injury. And he always brings back the biggest piece of meat for the tribe. And he's also very brash. He's very loud. He's very noisy. And people don't like the way he speaks, but because he brings back all nice pieces of meat, people adore him for that. And he's made chief because of that. In a way, also because of him being famous in that so-called tribe, he gets to have many partners also. Let's move on to Aming. Aming is not as fearless as Abing. He's pretty much what we call reasonable fellow. However, in the recent hunting trip, he didn't see an oncoming fierce animal. So what the fierce animal did actually was it bit off his leg. Upon Aming's leg being bitten, he retreated to the cave you see behind in that picture. He rested there. When he rested, he felt sad. He felt alone. He had no motivation to go out. He just wants to sit there, rest. He don't want to do anything. He wonders about his future. What's going to happen now that I can't walk as well? Am I going to die? In fact, given that back then we don't even have antibiotics. But over time, his leg healed. And when the leg healed up already, he was actually able to figure out how to overcome some of the limitations that he has. So he fashioned out a walking stick, and with that he was able to walk slowly, and he could actually even resume hunting with Abing. Despite that, he always doubts himself, he worries about himself, he feels that, am I still good enough? And he still feels very sad because his leg has disappeared. Let's come to Ajing. Ajing is the guy that you see sitting at the edge of the cave there. He is timid. He's what we call commonly as the coward. He is afraid of everything. He doesn't live. In fact, he is probably a very weird one where he's actually considered a vegetarian because he doesn't hunt his food. He only tries to get hold of foods or vegetations that's around the cave. And even before he wants to go out of the cave, he would look left and right. He worries that there is something there. There's always danger around the corner. So he will only go out, pluck his food, and then quickly come back to the cave because he's very worried. What if there's a dangerous animal there? What if I get injured? What if I I don't know how to find my way back? He keeps thinking about all this. Despite that, he was able to live quite well with the vegetations that he forages. And of course, occasionally Abing and Aming will give him some food. Let's come to Aling. Aling is the character you don't see in this picture. He stays inside the cave. He is what we call the oddball. He speaks differently. Sometimes he's a very good storyteller by the stories that he talks about. Other times he seems to be able to predict the future. And there are also times that they just don't understand what is Aling talking about. Despite that, the whole tribe actually put Aling as a mythical fella who is their so-called shaman. They believe in him, they adore him, and to a certain extent they even worship him. So he doesn't need to come out to hunt. He doesn't need to pick vegetables or anything like that. The tribe feeds him and he's able to survive. Okay, all four characters here in this picture that I just described are all adults. Now, if you think back again, way back in that prehistoric time where they live, to be an adult, it's actually a very rare thing. Most of these so-called cavemen won't survive long. They will either be eaten, or they receive injury, or they hurt themselves, etc. However, these four people were able to be successful despite all their uniqueness, and they were able to find partners, they were able to procreate, they were able to make children, and so on and so forth. They become ancestors of other people. So let's move this story into modern times now. Earlier, I told you all the story about four different characters. Now, if we were to look now, here and now in this modern time, look at the people around you, look at the people you know, think about the people that is familiar to you. It could even be yourself. You will actually be able to identify that four characters, Abing, Aming, Aling, and Ajing, in people around you or even yourself. The extreme end, the Abing fella will be the guy that is wearing the gold chain, shirts untucked halfway, wearing a very flashy sunglasses, even though it's indoors. He will be able to take risks. He will be able to go make investments. He will be able to be driving a fancy car. If anything, if he plays his card well, he actually will be rich. People might not like his obnoxious way of talking. People might hate him because he seems very rude, etc., and even arrogant. However, in life, he would be successful in terms of wealth. He would be successful because they would be partners that will be looking for him to procreate in view of his wealth or in view of his so-called success. And people would actually avoid or ignore all the so-called traits that we talk about that is annoying. In fact, it only be termed as annoying. It isn't termed as disturbing. Sorry, yeah, I've just been told by the panelists I'm a bit soft. I'm just going to put this over closer here. Okay, am I speaking a bit louder now? All right. Okay, so as I was saying, Abing is someone who is annoying, but successful to a certain extent. Now let's look at Aming. Aming was your typical day-to-day fellow that goes on with his everyday life until recently where he experienced a loss. It could be a loss from a pass away of someone who he's, someone he loves, or it could be a loss from like loss of his job, loss of a relationship, loss of a material thing, any loss. Because of that loss, he started feeling sad. He started to keep quiet to himself. He started to be withdrawn. And because he's also the teary type, he started crying. Little bit things is able to cause him to cry. Despite that, his sadness, his low mood that he presented was actually able to give him some form of respite from the loss that he experienced. He's able to process through it. He's able to go through it. And as a result of that, very soon, while he was not able to forget his loss, he was able to make room for the loss, and he's actually able to carry on with his day-to-day life. Aling, the constant worrier, the guy that looks at everything as if it's the end of the world. It could be because something happened when he was in his childhood or not, but this very same guy that worries about everything, that worry actually causes him not to take risks. Every decision that he makes is thought of carefully. He balances all the risks and minimizes all of it. And in certain jobs, he's actually able to do well, especially those when it comes to risk management, when they need to mitigate or have the lowest risk before any decision. The guy that worries the most, the guy that pays attention to the most detail, is the one that's going to make the best decision. And this is where someone who worries a lot comes into play. Despite that also, someone who worries a lot is also someone who is willing to make sure that everything is in place before they take their next step, before they make their next move. They don't take unnecessary chances to the point where they actually incur losses or they incur injuries or they incur damage to themselves. If anything, someone who worries a lot will actually lead a very stable life, although maybe a dull life, but he's able to lead a very stable life. And last but not least, we spoke of 3 characters. The one last one that's I can't even draw here is Aling. Aling is the so-called oddballs of our societies. It goes from a wide range. You can be seen as the person that walks down the street who doesn't wear clothes, to even your friend that believes in unicorns. I'm sure all of you here would have someone that you know that seems to talk oddly, seems to behave differently, but yet they are able to carry their job well. I know I actually have a close friend, a doctor who believes in unicorns, who believes in magics, but my friend is actually a very well-respected and very high-functioning doctor, a specialist in fact. And I'm sure all of you would know someone like this, someone who, on the day-to-day conversation, you feel that it's so magical and so odd. But when it comes to their life, they are actually able to carry out and live a very nice life. I mean, they are able to interact. They are, in fact, friends of yours. So, why am I talking about all of this? Why did I tell you all the story about someone from a caveman all the way to modern times? Reason being, I think mental illness is not something that only it's an illness that happens just like that and it becomes an illness. Instead, I believe that our mental health is a range, is a spectrum. And that spectrum means that all of us would fall within different ranges of that. And if you look at your own life, if you divide your own lives, I'm sure you will be able to relate to bits and pieces of the things that I talk about just now, of those 4 characters. I'm not talking even about many other diagnoses, but I'm talking about just 4 things. I use this picture to represent someone who has bipolar. Bipolar is someone who has extreme mood swings. It's as if their switch for their moods is broken. They don't have something in between. They go between extreme high and extreme low for their moods. But for someone who live at the edge of the high extreme mood, they are more willing to take chances. They are more willing to make things take a step forward. Also in a way, their libido is even higher. As such, these are the same people who are going to make the decisions that's going to make the biggest impact. They are going to make successful business deals. They are going to find successful partners. They are going to do many, many other things. Depression. Someone who is sad. Sadness is a mood that we all experience at one point or another. And when we experience a loss, I'm not saying all depression cases or all depression, people suffering with depression experience loss, but majority of us will suffer a loss of some form before being pushed into depression. That sadness, that low mood that is present there is actually your mind trying to protect you. It's telling you, look, I'm going to make you feel a bit uncomfortable now. I'm going to make you feel tired. I'm going to make you feel unmotivated, unable to focus on anything because you just experienced loss. I want you to slow down. This is your mind telling you, I want you to slow down so that we are able to process what is ongoing now, so that we can think about what's ongoing, so that we can make plans for our future. What are we going to do next? I need you to slow down now. And that's where someone starts feeling sad, feeling unmotivated, feeling pretty much what we call depressed. It's there for a reason. It's actually there to protect us. And when we don't process that loss, when we have difficulty processing that loss, in fact, another illnesses pop up. We call that PTSD. Someone who experienced trauma so badly that but their body or their mind didn't have the opportunity to process it, they just relive the same memory over and over and over again, and it becomes problematic for them. So our mind actually needs time off to process anything that we experience that is very, very difficult, and in this case, loss. Anxiety. Anxiety disorder is fear. It manifests itself as fear. There are many, many forms of fear, but fear is there also, again, similar to low mood. It's there to protect you. When you worry about something, you become more careful. When you have panic attacks because of a certain trigger, that trigger probably might have hurt you before this. Now your body is trying to tell you, alert, alert, you had experienced this before. This might hurt you again if you go down the same choice of behavior. So that all the whole thing about fear is actually is trying to protect you so that you reconsider your risks and make sure you don't go ahead. I can tell you, coming up here to talk in front of this screen, talking to the screen without being able to see any of you out there creates anxiety, because my fear is I do not know what you are thinking. I do not know what your reactions are. That fear causes palpitations, and it causes me to, let's slow down a bit and maybe let's relook a bit before I carry on with this talk. Of course, after thinking about it, I'm able to give this talk to you all despite the fear being there. So fear is just sort of like our car brake there to slow us down a bit to make sure that we don't make any rash decisions. And now we come to the oddballs, the one that I keep talking about. Oddballs are different. I'm not going to say that psychosis or delusions or hallucinations has a role in our life, but I need you all to understand one thing. The same brain circuits that links up every part in your brain to the point where you actually develop psychosis, where you actually develop delusions or hallucinations, those signs and symptoms that we talk about, that we call people with crazy illness having. Okay, I know I use a very direct word there, but I'm just going to call it as it is. Okay, before we keep to that point where we lose touch with reality, that same circuit is going to govern a lot of things in your thinking process. It's going to make you be able to make sure you don't go around walking around naked in a socially unaccepted area. It's going to help you control your anger. It's going to help you feel pleasure. You know, it's going to motivate you. It's going to help you see whether you can make rational decisions. And to a certain point, it's going to push you forward also. All of that normal functions is the same circuit that when someone is experiencing psychosis experiences, is when that same circuit get pushed towards the end, and the extreme end of it is when we see that they lose touch with reality. Prior to that point, that circuit is useful in our brain. It helps us a lot. If this circuit is turned off, you're going to walk very slow. You're going to experience no motivation. You're just going to be withdrawn and unable to do anything at all. So we need that circuit in order for us to carry out our day-to-day life. And there is one more thing. The point where we say that this circuit is being drawn to the point where someone loses touch with reality, it's often being shaped by our own perception. Where do we say that this is odd? I have friends, earlier I told you, that believes in unicorn. I'm not going to say that my friend is odd. I'm not going to say that my friend is actually experiencing psychosis. For some, having this ability to talk about stories, to talk about things that seems ununderstandable, your spiritual, your bomos, your monks, not all of them, but some of them, might be because it's a skill that is appreciated by the society. So why am I talking about all of this? Why did I tell you about that story? And why did I move on into psychiatric illness and I put it the way as if psychiatric illness is a useful thing? Because we were brought up from very young. We were all told from a very young thing is that mental illness is a bad thing. You do something bad, we're going to send you to a mental institute. Here being in Central, we're going to send you to Tanjung Rambutan. We were all told, and we were told stories about that. We were all brought up that we cannot have mental illness. So we all were taught to see mental illness as something yes or no, black and white. It's either there or no. But instead, our brain don't function that way. We work in a whole spectrum or whole range of colors. And some of the things I described earlier, you all might have experienced on your own. And it's actually useful. It's actually going to shape some of the things that you carry out. And the other reason why I want to talk about this, just to point out to you all, is that it doesn't mean when you're experiencing difficulties or you're experiencing problems carrying out your day-to-day life, it means that you have a mental illness directly, yes, and therefore you need to seclude yourself, you need to avoid people, etc. Instead, sometimes the things that we experience is just part of this rainbow that I show you. It could just be a normal psychological or mental experience that we have as part of ourselves. Because keep in mind, all these experiences probably have its own uses, and that's why it's being manifested here. And the other reason why I talk about this, about why we have this spectrum and all these things, is if you can understand that, you know, the behaviors, the way we think and all this is actually a spectrum, there's no black and white, it actually makes mental illness a bit more easily accepted. It's not just something that they are out of this world, they are not us. Instead, they could have experienced the same spectrum that we talk about just now, and somewhere along the line, they needed help. And sometimes when we actually provide the help or they seek the help that they require, they will actually go back down to a more acceptable function or acceptable spectrum. So I'm not saying that mental illness is something that must be accepted and don't do anything about it. Instead, what I'm going to highlight here is that if you experience that range of difficulties, the thoughts, the emotions, the behaviors that you go through, and it ceases to become useful, it suddenly has become impaired. We talk about someone with bipolar, that risk-taking one. The risk-taking is going to cause that someone to end up taking risks and lose all their money to the point where they're going to go bankruptcy, but they still put out more and more money, or they go around driving fast cars to the point their life is actually endangered. We need to put a stop. We need to provide them help because that so-called risk-taking has gone beyond what is useful. And now help needs to come in. Same for depression. Your brain, your mind is actually telling you to, let's take a small break, let's slow down. But if that slowdown is so long and so debilitating that either you want to end up hurting yourself or you are unable to continue to go and work or you end up going hungry, we need to do something about it. We need to provide the help. Anxiety also is that fear is there all the time, 24/7, to the point where you're unable to, carry out anything or do anything at all. Then we need to intervene. Psychosis, once you go tip beyond that point where I mentioned, we need to help because that someone is really losing track with reality. So all I'm saying here is that everything that we experience is on a scale. There's no black and white when it comes to mental illness. For some, sadness is actually something that's useful and reliable. Same for fear, same for even the extreme ends of risk-taking, etc. However, when it becomes impaired, help is needed. Help is needed either if you're experiencing something like this, you go and seek help from mental health professionals, or if you know somebody who's experiencing this to the point where they actually are experiencing impairment already, help them seek help. So our collaborators, Pfizer, actually worked with our national organization and came up with this mental health handbook. This is one of the ways that you are able to access some information about mental health. And if you all would like to scan the QR code now, you should be able to access this mental health book that we talk about. And I hope that whatever I discuss today, whatever I point out today, will give you all a different perspective on mental illness and become more willing to accept it, or in fact to help other people to get help. Okay, so with that, I thank you all, and if there's any questions, I think we can open for the Q&A and also the audience discussion.
Thank you very much, Dr. Eugene. I think it is a very insightful talk that you have given to us. I'm sure all of us have enjoyed how the story of Ping, Ming, Ling, and Jing, and that's very interesting. So I think that uh, the end of the presentation, before we go to the audience discussion, I would like to encourage every one of you to post your questions or queries or anything that you may have in mind. Feel free to leave those comments and questions in the Q&A tabs or the chat tabs so that we will be able to discuss with our speaker later on. So while waiting for that questions, perhaps let me start with the ball rolling by asking Eugene. Yeah. So when I listen to your talk, it's very different from what we have think about psychiatric disorders. So I think you are trying to open up our minds by saying that psychiatric disorders or psychological problems are in fact a spectrum of diseases, right? So do you think that especially at this point of time during the COVID-19 especially, we really need this different perspective or different ways of how we carry our minds?
I think we do. I do agree, and it's one of the exact reason why I point this out, because our world was thrown into chaos when COVID started. We were all thrown into this thing that we were all unexpected. We do not know how to deal with it, and different people react to it differently. But one of the common questions I keep getting is, I keep getting people, my friends, even public, that's asking me is that, doctor, I can't sleep. I keep worrying about my future. I've lost focus. I'm unable to, I keep having these thoughts about what's going to happen, and I keep worrying. Am I unwell? Am I having a mental illness? Yes, usually when they ask that, we feel that they are impaired enough, we actually ask them, can you come in for consultation? But most of the time, I will actually tell them, your mind is having a break from routine at this point due to the COVID. This is something that we have not experienced before. Your mind do not know how to process it. So your mind is trying to protect you or trying to help you by processing it the best way it could. So if you're someone who actually has a tendency of worrying a lot, you might end up noticing that you're worrying more than usual. If you're someone who perhaps have a tendency of, when there's no sense of purpose, you feel low, you feel depressed, it could just be your mind trying to tell you, slow down a bit, let's relook at all of this. And if you don't have the opportunities to do the things that you need to do, you might find a sense of loss of purpose. And again, all the difficult thoughts or emotions will start popping up. It's not because you are going mad. It's not because you're actually experiencing mental illness. It's just maybe your mind trying to make sense what's going on, and it use its best way that it knows by telling you things or by pointing you out on these difficulties and ask you to do something about it. But doing something here doesn't necessarily means actually um, going to see a psychiatrist. It could just mean maybe you just need to relook at some of the purpose in life, or have someone to talk to and experience the thing, or discuss the things that you're experiencing.
Yeah, that's that's good answers. That's very good answer. So, I think maybe we can pick some questions posted by the attendees of this webinar. I think one of the questions is actually asking, where can I seek help for myself or others on mental health issues? What can I do or help if my family members experience depressions?
Okay, so that's two parts of the question. I think let's start with the first one. How do I seek help for myself and others for mental health issue? Um, there are many ways of actually seeking help for mental health issues. We don't just mean coming to see a psychiatrist. Sometimes it could be as simple as finding someone you trust to ask for help. I am a close friend, a family member, a close relative. I am currently experiencing this difficulty. I'm not sure what I should do. Maybe you can advise me. That could be something personal. Or it could just be maybe reaching out to one of your social support. Commonly, we would actually recommend talking to your religious body, going to your ustad or even your priest or even your pastor. Maybe ask them, look, I'm experiencing this. Are there any advice you can provide me? Or if you feel that you're more inclined to actually seek help from a so-called medical professional, um, maybe your office has what we call employer support program. Ask them how to go about with it. Or if you're still schooling, most schools or most education institute has counselors or mental health professionals on standby to assist you to seek help further. That's one. The other thing is that you can actually even just walk into any GP and says, look, I'm not feeling well. GPs means your general doctors around. It's not necessarily government, but any general doctors. I'm not feeling so good. I think I might need help. They can, most GPs are actually trained to listen and to provide advice on whether they can help you or where to seek help next. Of course, you can also seek a whole range of mental health professionals in the private and in the public sectors. You can see counselors, you can see psychologists, you can see psychiatrists. All of this, I mean, of course, there's help seeking methods for all three of them varies depending on locations, but you can also approach that. What is standard among the later ones, that means the GPs and your counselors and psychologists and psychiatrists, is that we don't automatically say, here, come in, let's diagnose you. Instead, no, all of us were trained to, let's listen to you first and let's see what we can do. Are you actually experiencing difficulty to the point where we need to move a step further, or maybe we just could offer you a year to hear you out, and sometimes that's all they need. Okay. With regards to the second question, what can I do or help if my family members experience depression? Because I'm not sure when you say depression here, is it the illness itself, or could this just be a low mood that is a reaction to something that someone is experiencing? Remember, as I pointed to you out in the stories that we shared just now, low mood is something we all experience as the range of emotions that everyone goes through. None of us here, I believe, would want to throw away all the emotions. Our life will become, emotions make us humans. Emotions make us what we are. So nobody here would say, I don't want to feel emotions anymore. So sometimes when we experience a difficult situation, we actually end up becoming sad. We actually become depressed. Most of the time when in that situations happen, we just need time. We just need time, as I point out in the story earlier, we just need time so that we are able to process what we're going through. And most of us will come out unscared. However, when that sadness actually persists much, much longer, or it becomes so difficult that the day-to-day activity of life is affected, then we will need to seek professional help. So if your family member is experiencing that, then advise them or assist them so that they are able to seek help in the same pathways that we talked about just now. And if you yourself experience it, then you need to make a first step to, go ahead and find someone who's able to assist you to be able to seek help for that depression. But if the depression here that you asked in the question actually means someone who's already experiencing depression, the illness, the mental illness, depression, the illness is diagnosed already in a way, what you can do as an external party is actually be supportive. Don't be judgmental to the point where it's all in your head, this low mood, just get out of bed and do something. Don't try that. That doesn't help, because the mind that your family member is experiencing is beyond their control. They have no control over emotions. And as a result of that, they would need external help, either through psychotherapy, to medications and all this. And you just need to be someone who's going to be supportive to help them experience or go through the experience that they are having. Supportive here, just, be there for them. If they need help, offer them help. If they want to want someone to talk to, offer them that. Okay.
Yeah, totally agree with you, Zach. Help is always there if you were to reach out at the prompt time. Yeah. So to keep the questions actually going, so there's actually one participant who asks, how can we help if our friends, they are not willing to seek for professional help? Is there any way to convince them to come forwards to seek help?
Okay. With regards to this, it really depends on why they're not willing to seek help. If the reason they don't want to seek help because they find themselves as, what I'm going through is normal, is part of what I usually go through, that makes perfect sense, because as I pointed out to you all, most of us will experience a so-called range of thoughts and emotions that we talked about earlier, and that could just be deemed as normal. They themselves don't see that is abnormal. So if that is the scenario, then I would actually advise pointing out to them that, look, you are behaving in such a way that is useful for you, but you see it has consequences, it has painful consequences to yourself or to others. And because of that, maybe you just need to find someone to talk to first, to see a second opinion or to get an opinion. That's one scenario. The second scenario is actually to find out, are they not willing to seek help because of the fear that I talked about earlier? The black and white view is either you have mental illness or you don't have. And if you have mental illness, it means that you are going to be a evil person, a bad person. You're going to be experience a lot of unpleasant effects from other people or even for themselves. Remember, all of us were taught from a very young age that mental illness is bad. If you are behaving inappropriately, if you don't feel the way that you should feel, you are going to be punished by being sent to the mental institute. You're going to be punished by a mental illness. And this is ingrained with a lot of us. So ask them, is it the reason that they are not willing to say out? Is it a fear of this, fear of being diagnosed with mental illness? And with this particular scenario, most of the time when the client comes to me and they tell me all this, I will actually tell them, at the end of the day, I might give you a diagnosis, a name, a label, but that is just mainly for us to communicate, to tell you, oh, look, whatever you're going through is this what commonly known as. But I'm not going to focus on that. Instead, I'm going to focus on what is causing you difficulty. Is your low mood being excessive? Let's work something on that low mood. If your fear is your fear excessive? If it's excessive, let's work on that fear. Let's see if we can do something about it. And when we do all this, it tends to make help seeking more approachable, and people are more willing to come over and ask about it. And this is usually the other reason. The third scenario for that question is that if that person have lost touch with reality. The question, if that person actually lost touch with reality, the extreme end already, then we would probably need to ask help, maybe get the police to come over to bring them to the hospital, or even get someone else to additional, is there any way to convince them whatsoever to come over? That one is more of the extreme case of someone who's not wanting to seek help. For that, it's usually case by case basis. I would actually recommend speaking to a medical professional, a psychiatrist or even a GP or any doctors, and they should be able to advise you further what are the steps or what are the options that's available.
Yeah. So, sorry, I mean, earlier on, I think Dr. Eugene, you was mentioning about some of these emotional states, for instance, anxiety and emotional problems, they have evolutionary needs for human beings. So I'm just wondering, are there any ways to overcome these anxiety and emotional problems when they becomes destructive to one's life?
There are ways. Let's break them down. Let's put anxiety and depression as two separate things. Remember, depression or the low mood or the sadness you experience is there for a reason, to ask you to slow down. When it becomes overwhelmed, then we will need to do something. Intervention comes in the form of psychotherapy, because keep in mind, a lot of this is our mind telling us about it, to slow down, to slow down. If by ways of actually having psychotherapy, having what we call talk therapy, for all you know, you might change the perspective of your mind, and that makes the low mood become more acceptable and you're able to move on. Anxiety is the same, because the way it's there to protect us, but when it becomes too excessive, then we might actually need to go through some of this reframing or retalking. But anxiety also has one more thing. If you recall, most of your self would have experienced fear at one point or another in your life. But when you force yourself to go and face that fear, say maybe fear of roller coaster, and you force yourself to sit the roller coaster, suddenly after that, your fear of this roller coaster will actually reduce. So anxiety is the same. Sometimes it's just a means of actually asking us to just face it, and then the anxiety will actually reduce. These both examples are just the what we call the ones that haven't caused severe impairment. If all of these problems have actually gone to so severe to the point where you cannot carry on your life normally, maybe we need to have medications that come into play. And of course, that means going to see a psychiatrist, and we prescribe medication to assist. Medication is not to get rid of sadness. Medication is not to get rid of the fear. Instead, medication is going to be like the tongkat that Aming was holding. It's going to assist you so that you are able to work with it, you're able to make room with it better, and carry on with your life. We don't want to give you all medication to the point where you no longer can feel anything. We know we have clients because we keep giving medication, they end up experiencing what we call emotional blunting. So they'll come and tell us, doctor, I don't feel sad anymore, but I don't feel anything at all. And that's when we know that, okay, the medication is too strong already. We cannot stop them. We actually need to reduce the medicine and come back so that they can still feel some sadness. They're still being able to feel something. And as I mentioned just now, feeling is important for our day-to-day life. Everybody needs to feel, and nobody wants to feel nothing, right?
Yeah, so there's a lot of my patients actually that they ask these questions like, if I come forward to seek treatment, is it always necessary for me to take medications? So, which is actually asked by the same participants have the same questions. Is there a better way to improve mental health, being drugs or therapy better for mental health condition, or I can just exercise and so?
I think it's case by case basis. I don't view it as a either or option. I do know different mental health professionals practice differently. Some would be more inclined to give psychotherapy. Some would be more inclined with biological treatment or medications. Some will only give medications. Different clinicians will have different approach. The way I see it is that find the balance to see which one works the best, which one you're more willing to try, and work with your clinicians, your therapists to see how you're able to progress. Keep in mind that there is one caveat with all of this, is that we were all also taught from a very young age that we cannot feel sad, we cannot be afraid, we cannot feel angry, we cannot feel frustrated. These are all feelings that we were told from a young age. Stop crying, stop feeling sad, stop being angry. You know, we were all told that, and some of us might even be guilty of actually telling our own kids that. We need to keep in mind and be mindful that these mood and emotions are part and parcel of us being humans. And sometimes it's there, but it only becomes problematic when we only focus on these difficult emotions over and over and over again. So the way to actually get rid of not being too focused on this range of difficult emotions could either be the help of medication, or through therapy, or even sometimes just for yourself talking to somebody else. But there is no right or wrong, no which one should be doing more or which one should be doing less. It really depends on what you're comfortable with, and which kind of that your clinician or your doctor is more inclined to. You need to discuss with them. And if you find that you don't pair well with them, then maybe you just need to find another clinician that is more inclined with your style that you're comfortable with. It's all about building up an alliance between you and your doctor to see which one works best. And even it's the same for psychologists, even for the same for counselors, even the same if you decide to seek help from a religious authority. You know, if you don't agree with what your ustad, your pastor, your priest says, then you might actually want to seek another opinion and just find which way or which path is the most comfortable.
Yeah. So I guess we all know that treatment of psychiatric disorders often require us first to assess the condition and subsequently individualize the treatments, right? So I think that's the keywords over here. So the next question I have with you, Dr. Eugene, is some things that I think is close to your heart, which is stigma.
Yeah.
Okay. And actually, the question sounds like this. How can we change the stigma that surrounds a person who wants to seek professional mental help? Because usually the people who seek help will be labeled and seen as someone who is crazy or abnormal by their friends and family. I think this is quite true, right? So I just wondering what's
Very
your
true.
opinion on this?
Okay. Stigma itself is a very complicated relationship between someone who's experiencing mental illness and the people around them. I usually look at it broadly. The stigma that the person have onto themselves or the stigma that they receive from other people. For the stigma that they have upon themselves, I would do usually what I mentioned to you just now. The diagnosis, the label is just means of communicating to tell you what illness you have so that you are able to learn more about it. But that shouldn't be the focus. Instead, the difficulties of the individual signs and symptoms that you're experiencing from that diagnosis is where I need to focus. So I'm not going to, you should tell yourself that I am not someone who is experiencing schizophrenia. I'm someone who is experiencing hallucinations, and this hallucination is causing me to lose touch with reality. I'm not someone who's actually having a depression. I'm actually someone who has problems processing what I'm experiencing now, and I need to find a way to either go through it by the assistance of medications, therapy, or find another way of methods that work. I am not someone who is having a panic disorder. I'm not someone who is having general anxiety disorder. Instead, I'm someone who's experiencing a lot of worries. I'm having panic attacks here and there because of my past fear or because of something that has happened or even going to happen that I'm worried. And that thing that the experience I'm having is the one that is making me uncomfortable and causing problems for me. And I need to look at that and see a way to work through it or go through it or live with it or accept it, depending on whichever you're experiencing. So it's not the label, again, because the label itself is the one that usually causes a lot of stigma in an individual. Advise them to actually focus on the difficulties that they are experiencing. As for stigma that is being given by people surrounding the person with mental illness, I would actually educate them the same way I educate or I talk about here, in the sense that some of the experience could be normal. Whoever who's around them are also going to go through that. It's just that I have problem working through it more than other people and I need assistance. The way you look at me, it doesn't mean I have already gone to that. It's just that I have a bit of problem in this particular area that I need help with. And sometimes also talking about the fears, that means, okay, my relative, they labeled me as crazy. They're worried about the things I'm having. I will actually go on and ask, what are you worried? What is your fear about my diagnosis? And sometimes it could just be, oh, because I have depression, they feel that I'm going to commit suicide. Because I have schizophrenia, they fear that I'm going to be angry or aggressive. And then we just need to tell them, no, it doesn't happen that way. The same approach also, if you see other people delivering that kind of stigma towards the person with mental illness, you can actually ask that person, why are you reacting this way? More often than not, people will tell you the fears or the worries, and then explain to them, no, this is actually a myth. It's essentially debunking the myth lah. More often than not, when someone has close encounter with another person who has mental illness, they are able to dispel a lot of all this myth. Their own stigma actually reduce. So the only way to actually to approach that best is actually tell them straight, approach them and face their so-called misconception and fears, and that would kind of help to reduce the stigma. This whole thing that I just talked about, stigma, is this is basically a very superficial part. It's a much more complex and might even involve politics and all these things, but I'm not touching that. This is the day-to-day stigma that experiences that I see in clients, and this is usually what I would tell them.
Yes, I think combating stigma is a long journey, and it takes a collaborative efforts by the stakeholders, everyone's, and patients themselves as advocates. So, I mean, now we are actually left with another 5 more minutes before 4. So going back to the title, the world needs all kinds of minds. So I think we have many participants here. So we have all different minds listening to your talk. So just want to tap into your mind. Any final message or concluding statements, Dr. Eugene, so that we have a synchronized minds as yours?
I wouldn't want synchronized because we do need the whole broad spectrum. Well, final words is first we need to thank Pfizer collaborating with us because they do assist us with a lot of these logistics and they provide us with a mental health book, which again I highly recommend all of you to take a look if you all missed that thing. I'm opening the code again. This is quite a good book that's being done on the national levels that's being shared. And secondly, the take-home message today actually is that mental illness is not a black and white thing. It's not you have it or not. Instead, it's a range of experience or emotions or thoughts that everyone go through at one point or another. It's just that sometimes it becomes troublesome. It becomes problematic to the point where you need additional help. And if we were to look at mental health from that perspective, that spectrum, and that we do range around it, it would actually make mental illness more acceptable. It would make help seeking much better, and in fact it allows people to be able to understand some of this mental illness and issues that everyone goes through much better.
Okay, that's a great message for all of us who have spent the last 1 hour listening to Dr. Eugene's talk, which is actually a teaser of a series of mental health public talks organized by the Department of UPM. So this is the first one. I think the second one is on the 24th of October by Dr. Ang on the new normal of mental health. And it's again the collaboration with Pfizer. So at the same time, right, for Eugene, I think it's 3 o'clock as well. So
yeah, and then with the same link. So.
Yeah, same link, same time, same collaborator, same organizer, but it's a different topics. And that's actually after the World Mental Health Day, which is on the 10th October. So I think as a concluding statement, I would like to extend my gratitude again to the speaker, Dr. Eugene, and also Pfizer again, and all the participants today for spending the very wonderful evening with us today, listening to this very different perspective topics. I think it serves as a purpose to not only reconsider any negative emotional state, but it's also trying to help to normalize and psychiatric disorders. And don't forget that help is always available. Right? So, I mean, there's 2 more minutes show. So anything that should be, yeah, it's actually 1 more minute. So,
Yeah, I think it's
yeah, any final words? Yeah. Yeah. All right. Once again, thank you, everyone. Take care and kita jaga kita. All right. Take care.